Having spent over US $78 million since 2011, the project helped in availing free maternal services to disadvantaged women, improved the remuneration of healthcare workers, and also assisted in the building of health infrastructure in over 50 districts in Zimbabwe, many of which were rural. World Bank country manager for Zimbabwe, Ms. Anita Fernandez, says the program was done under the Health Sector Development Support Project.
1.4 million women received 4 or more prenatal care visits, and 1.1 million women delivered in the supported facilities.
Zimbabwe's Health Minister, Dr. Douglas Mombeshora, urged other donors to chip in for the continuity of the RBF program, saying this handover should not mark the end of reviving the country's healthcare services.
As we celebrate these achievements, we must also recognize that our work is far from over. The closeout of the Health Sector Development Support Project does not mark the end of our efforts, but rather the beginning of a new chapter.
Sarah Pia Dandara from Harare's Rujeko Clinic reiterated the need to continue with the RBF program as it assisted communities, particularly those in the rural areas.
This program was supposed to continue because people are still giving birth, people are still getting sick, and disasters are still falling on us. Its continuity would go a long way in shaping more projects that will enable us to do more and help more people in Zimbabwe.
One of the project beneficiaries, Maria Mlambo, said the RBF's urban voucher system helped her to deliver a healthy baby after being abandoned by her lover.
I was helped by the urban vouchers program in 2023. I was 5 months pregnant when my husband deserted me. I had 2 other children to take care of and pay school fees for. I was struggling and living on street vending, selling floor polish. My feet would swell. I would go hungry and fall sick. I'm grateful for the program because it came through right when I needed help, and I delivered a healthy baby.
The World Bank handed over the project to government yesterday at a ceremony where community-based workers were saddened at the likelihood of a spike in maternal deaths coupled with unsafe abortions and general poor health service delivery, something that has been arguably significantly reduced during the lifespan of the RBF project. Despite this setback, government officials say they will swiftly take the necessary measures to ensure that the health services won't degenerate. But independent health experts believe that this will have a devastating effect on efforts to reduce the high maternal mortality rate in Zimbabwe, payment of healthcare workers, and revival of the collapsing infrastructure. Evans Zininga, VOA News, Washington.